Good morning. My name is Kobe Winston. Can you say your name for the record, please?
Good morning, Kobe. My name is Nathan Seth.
And what is your candidate number, please?
My candidate number is 221143450.
Thank you. And you are taking this test as a nurse? Is that correct?
Correct.
Thank you. Can I see your ID, please?
Sure, here it is.
The warm-up questions are not assessed, and is a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are some of the things that you love most about being a nurse?
I love the feeling when my team has a great surgical case, and everyone is working together like a well-oiled machine. I love knowing that many of my patients will begin their healing journey in my OR. I love the endless amount of learning and science that the healthcare field offers.
What did you dislike about your previous workplace?
To be honest, there was nothing that I disliked in my previous workplace. Working there was always something I looked forward to every morning. There was one thing, however, that I was slightly uncomfortable with. My previous workplace had 2 hospital buildings and each building has its own ICU. Both the hospital buildings were at a distance of 5 kilometers from each other. Public transport in my previous work area was limited and not easily accessible. When there was a shortage of ICU nurses, I often had to shuttle between both the buildings and handle the patients in both ICUs. This often got a little exhausting and made me slightly irritable.
Describe a situation where you were able to perform under pressure.
We were doing a routine assessment in a respiratory ward when a patient with severe respiratory infection, patient suddenly showed difficulty of breathing. I instantly rushed for the emergency crash cart while my colleagues called for the physician and performed CPR. I assisted with the intubation, keeping a close eye on the monitor. Unfortunately for me, another one had a respiratory arrest in the same room. It was a difficult situation, but we all managed to intubate and resuscitate both patients.
Correlate your work experience and things you have learned from it.
I started as an EMT and had the opportunity to transport patients to various emergency rooms throughout the city. And I was always impressed at the thoroughness, professionalism, and skill of the doctors and nurses that I encountered here. Bigger facility gets a good number of advanced trauma patients, and I am looking forward to applying what I have already learned, while still having the opportunity to learn from a seasoned and professional staff.
Looking back, what training did you wish to have gotten from your previous position?
My previous position was demanding, and the tasks were not easy. I was fortunate enough to have superiors who supervised with honing and improving my skill. However, I believe that, if I have been given enough training at different stages, I could excel much more. I wish I could be part of various workshops conducted last year, and technical training provided by the associations, also the Nurses Summit, in the southern part. Unfortunately, I couldn't.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good afternoon. I'm Nathan Seth, one of the nurses in the emergency department. How are you feeling now?
Hi. I'm all right. I want my discharge at the earliest.
Please be patient. Well, How may I address you?
I'm Kobe Winston. You can call me Kobe.
Kobe, you are being given the intravenous drip, and the drip is still running.
For what reason? The intravenous drip is connected. I fear the drip will affect my health adversely.
Don't get panic, Kobe. The intravenous drip being given is just to stabilize your electrolytes level. Instability of the electrolytes cause heart palpitations and can lead to other health issues. May I know the reason for your fear, please?
The drip may affect my diet pattern. My body will be getting more calories than required.
All right. If you could share your required calorie, I can help you with a balanced diet for the day.
My required calorie per day varies with the physical activities in the day. As I'm in bed rest here today, I don't require much calories.
Oh, I see. So, have you got a personal dietitian?
Well, I don't have a dietitian. When I plan to have food, I calculate calories of the food stuff by myself. After a proper planning, I'll fix how much quantity I have to consume.
Okay. Anyway, I can assure you that the IV fluid will not increase much calories in your diet.
All right.
However, if I know your required calorie and diet pattern, I may help you in a better way.
Why? Why do you want to know my diet pattern?
Calm down, Kobe. If doctors know your diet habits, it will be more helpful.
Why, it's their business to know about my personal habits.
It is for the therapeutic aims I'm asking these questions. Be calm and kindly cooperate with me.
I'm perfectly all right. Please stop this drip, and let me discharge from here.
Kobe, try not to worry much, you will be fine.
All right.
Kobe, now please listen to me. A psychiatric doctor will come to see you.
What? A psychiatrist? No. I'm here not for that.
Please listen to me.
These doctors are only for crazy people. And there is nothing wrong with my mind.
Let me please complete, Kobe.
I don't want to hear you anymore. Get my discharge as quick as possible.
Kobe, you have some misconceptions regarding your diet pattern, which could affect your health adversely. So, a psychiatric doctor can give some better advice for you regarding the same.
Stop, please. I'm not understanding you in any way.
I can see that this has been very difficult for you to cope with. However, your eating habit is the reason why you are here in the hospital right now.
What?
Yes, Kobe. It's your diet pattern that's making your health conditions much worse.
No, I don't think so.
Kobe, it's the truth. And, why a psychiatrist, instead of a dietitian, will be your next question. Isn't it?
Yes, I need an explanation for that.
Sure, your concern is reasonable, and I'm glad to explain it to you. Presently you have made your mind that calorie is everything. But beyond that, there are several essentials, which you haven't considered.
But so far nothing has happened. Also, I have achieved what I'm looking for.
You might not feel anything wrong. That might be right. Even though your health was getting affected. And now, your physical health is not satisfactory.
Oh no.
Unfortunately, it's true. Since you made your mind in such a way, automatically, there will be resistance from your side. Hence, your mental health should be cared first, and then we could make the necessary changes in your eating behavior.
All right, so what do you want me to do?
Don't get upset, Kobe. We are here to help you. Proper treatment and medication, along with a healthy diet, can bring your lost health back. Also, a healthy lifestyle and exercise can help you achieve your goal.
Okay, I can follow that.
All right, so kindly cooperate with us. The psychiatrist will meet you shortly.
All right, I'll wait.
Thank you, Kobe, for listening to my words. I wish you a speedy recovery.
Thank you, nurse.
You are welcome, and by the way, if you need any further assistance, kindly press the bell button on your right-hand side.
Sure, thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.